Hey, it's Dr. Langley coming at you with a quick video today. So skin cancer, something that scares a lot of people. Your skin's out there, it's getting all sorts of exposure to weird stuff, radiation, all that good stuff, not really bad stuff. And you're wearing sunblock like you should be every day, especially on your face, but you're still worried that your indiscretions when you were a teenager, being a lifeguard, sitting out in the sun all day, or tanning. Oh, no, tell me you didn't tan. Have put you at higher risk for cancer. So let's talk about what skin cancers are out there. So there's basal cell carcinoma. That's not a bad one to have, actually. It's pretty easy to remove, much more likely to just sit there on your skin, cut it out, no problem, then it's gone forever. Cool. Squamous cell cancer, another skin cancer, similar story. It tends to look like a little sore spot that's not getting better on your skin. Same with basal cell, actually. A little scab that's not healing. Definitely a reason to get it checked out by a doctor, have it cut off, but usually no big deal at all. Melanoma, that's the scary one. That's the one that keeps me up as a doctor at night, that I've missed a melanoma. That's the kind where you see it, you can't just take off just a little bit. You've got to have a whole area of the skin removed to make sure that it's not anywhere near not spreading. So that's the one that I'm really worried about when I'm seeing patients in clinic and doing skin checks. So we have some signs that we look for to make us more worried about melanoma or less worried about melanoma when it comes to an individual spot. First, when I'm scanning the body, I'm looking for something that stands out, like an ugly duckling kind of mole. Like that one just doesn't look like the others. That's a little bit of a worrisome sign. So is, we call this the ABCs, asymmetry. So if one side looks different than the other, and they're not, you couldn't just fold it over on top of each other and have it look like the same kind of mole. That's more worrisome. B is for border. You want to have a nice clean border, not a squiggly all over the place border. That's more worrisome. That's less worrisome. It's kind of similar to, let's see, this is a nice symmetrical one. Actually, we'll make it longer there. Nice longer looking mole. That's still symmetrical. You could still fold it over on top of each other, whereas if it was doing crazy things over here and around the rest, that's a little bit more worrisome. C stands for color. You want it to be all the same color in one single mole, as opposed to having a black area and a brown area and a lighter brown area, and that's more worrisome. D stands for diameter. If it's about the size of a pen, a regular pen, like a pen on end, that's reassuring. If it's bigger than that, that's more worrisome. So we're looking for about 6 millimeters is what it actually is. So if it's more than 6 millimeters across, that's more worrisome. If it's less than 6 millimeters across, that's more reassuring. And E stands for evolution. If it's changing through time. So if you take a picture of it one day and then you look at that picture when you're looking through your photos on your phone a couple months later and it's changed a lot, that's more worrisome for melanoma. The more of these that are a problem with a particular mole, the more likely I am to take a little biopsy of it in clinic and send it to a pathologist and see exactly what's going on. Thanks for watching. Here's another video that you might be interested in. Here, be sure to subscribe to our channel so that you can find out when we post more videos. Thanks for watching.